Hi there, I'm going to be your nurse taking care of you today. Can you tell me your first and last name and your birthday, please? Okay, Alice Johnson, born in March 1946. How are you doing today? Any pain? No? All right, is now a good time for me to go over your medications with you? Okay, great. Just let me wash my hands real quick. Get out. All right, so I'm going to start with amlodipine. So that's going to be treating your hypertension or high blood pressure. Basically, it works by relaxing your blood vessels. So instead of them being really tight and the blood's going through it, it increases the pressure. It's going to make them nice and wide. So the blood going through there is going to decrease the pressure. So you're going to take this drug by mouth once per day. It doesn't matter if you take it with or without food. I would avoid the grapefruit juice and drink lots of water because you're at risk of having a lower blood pressure on this medication. So you want to make sure that you get your fluids up. Like I mentioned, you're at risk for hypotension or low blood pressure on this medication. So just make sure that when you're getting up from a laying to sitting position or sitting to standing, you want to do that slowly and dangle your feet off the side of the bed just so you don't have any dizziness, which can increase your risk of a fall. Some side effects you might have on this medication are dizziness, headache, some flushing in the face. Call your provider if you're having like severe dizziness to the point where you can't see, or you're having issues with walking, falling, stuff like that. So the next one is metformin. That is an anti-diabetic for your diabetes. So that drug works by decreasing the sugar that is absorbed by your liver and also produced by your liver. So we're controlling your blood sugar with this medication. Some side effects that you might have on this medication are nausea, vomiting, diarrhea, just some issues with your tummy troubles. So you're going to take this twice daily with food and water. Taking it with meals can decrease the chance that you're going to have some stomach upset. I would call the provider if you're having unusual cramping in your stomach, extreme fatigue or tiredness, and an increased like rapid breathing, because that indicates that you might be having some more serious issues. As for your diet, we're really looking to avoid foods high in sugar and fat because those aren't helping with your blood sugars, and we're looking to get that weight down. And obviously, if you can, introduce some physical activity if you have time for that. So next, we're taking ibuprofen. And for you, we're going to take that for your osteoarthritis, which is causing pain in your joints, I assume. That drug works by reducing inflammation in the joints, which is ultimately causing your pain. So reducing that inflammation and swelling in the joints is going to decrease the pain. So take this as needed every 4 to 6 hours for the pain that you're having in your joints. And if you're not having pain, there's no need to take it. Some side effects of ibuprofen, it can cause heartburn and nausea. I would discontinue this medication and call your provider if you're having severe stomach pain, because this can increase the risk of stomach ulcers and increase bleeding in your stomach and intestines. So you want to take this medication with food and water, because having stuff in your belly can prevent having an upset stomach or increasing that risk for bleeding in your stomach. So atorvastatin, that's going to be treating your high cholesterol. So basically it works by decreasing the cholesterol produced by your liver, and it gets rid of the bad cholesterol that's already floating around in your blood system, and then it's going to increase the good cholesterol, which helps to reduce the effects of the bad cholesterol. So as for diet, we're going to want to reduce foods high in fat, fried foods, cheeses, all fast food. That's not good for high cholesterol. You might want to start increasing what we consider good fats, so like fish, nuts, all that good stuff. You're gonna take this once daily before bed with water, because at night is when your liver is synthesizing all that cholesterol. So taking it before bed is going to decrease the cholesterol that your body's producing, and we really want that to halt. We don't want it to make anything worse. You might have some side effects of constipation, diarrhea, fatigue. You're going to want to call your provider if you're having symptoms related to your liver. So if you're having a lot of swelling in your upper abdomen on the right side, if you start noticing yellow tint to your eyes and your skin, if you're having any blood in your stool, definitely call your provider because you're having some bad adverse effects with the atorvastatin. Next is aspirin. We're taking this because you are at high risk for heart attack and stroke because you already have a history of high cholesterol, which is blocking your arteries, and the high blood pressure. So aspirin, once you take it, if you take it once daily with food, and you're going to want to avoid alcohol, it reduces the risk of blood clots from forming, and it's also going to thin out that blood a little bit, so things can pass through your vessels more easily, and things are going to become all clotted up with the fat that's already in your vessels. Some adverse effects of this medication include increased risk for bleeding, so you might have increased bruising, bloody noses. You might also have some abdominal discomfort because this medication can increase your risk for stomach ulcers. And you might want to call your doctor if you're having black tarry stool, because that might indicate that you're having some stomach bleeding, severe abdominal pain, or if you're vomiting up blood. Those are all bad things, and you're going to want to call your provider, let them know we might want to take you off this medication. Also, if you think you're having a heart attack, you're definitely going to want to call 911, probably not the provider for this instance, because overall we're taking this medication to reduce your risk, but ultimately it can still happen. And then lastly, we have the levothyroxine, that is treating your hypothyroidism, and that basically means that your thyroid isn't producing enough hormones to supplement your body's metabolism or breaking down your food and growing your bones and muscles big and healthy. Your body's not producing enough of that, so this drug is going to supplement that with the synthetic version of those hormones that your thyroid isn't producing. So you take this once per day on an empty stomach, ideally before breakfast, 30 to 60 minutes before breakfast. On this medication, you want to avoid foods high in calcium and grapefruit juice, that's the root of all evil. Adverse effects on this medication include an increased appetite, diarrhea, weight loss, an increased heart rate. And if you experience heart palpitations, a very rapid heart rate to the point where you can feel it, or chest pain, you're definitely going to want to call your provider, as this indicates you might be having a cardiovascular event. So, do you have any questions for me about any of these medications? It seems that you are very compliant with these, taking them as they should, and just wanted to go over these, make sure you know how these should be going. And no? Okay, well, it was great talking to you, Mrs. Johnson. I'll be back to check on you later. Is there anything I can get for you? Water? Do you need to use the restroom? All right, no, it was nice talking to you.